When I was asked to give this monograph on vitamin D, honestly, it felt like a huge gift because I'm a huge fan and a staunch defender of this vitamin. Like all vitamins, they're very important, but this one in particular is really getting a lot of attention right now. It's not that it's trendy right now, but it's finally getting the recognition it deserves. I'll present some basic outlines of the modules in the master's program on supplementation and vitamins conducted by the ESI. These are 4 quick points to clarify what vitamin D means. Let's understand that vitamin D, essential for life, is a pre-hormone with a multisystemic effect. And well, I want to tell you that these are just 4 quick points because we can go much deeper, but the idea is for you to understand what vitamin D really means. All right, so let's get started. And understand that what we call vitamin D, these substances that are essential for life, in this case, vitamin D is even more important because it's a pre-hormone, which means it has a multisystemic effect. It's also important to keep in mind that it's fat-soluble and steroidal. This is important because without fat, we can't synthesize it. Right now, we have a problem that for many years has turned into a war against fats in general. The approach is misguided because natural fats, the right fats, the good fats, are really important for the synthesis of vitamins and hormones. Since they are fat-soluble, they are essential for the nervous system. And without the cholesterol we fear, we can't synthesize them. The focus should be on sugar, insulin resistance, not such fats. Defending fats, vitamin D is crucial as it controls the expression of over 1,000 genes. So we have to wage war on sugar, on insulin resistance, but not on these types of fats that are so beneficial for the body. Vitamin D controls over 1,000 genes. It's multisystemic as nearly all cells have a nuclear vitamin D receptor. Ruth is going to explain this in depth later because vitamin D is so important for our body to extract all that information from our genes and to produce the proteins, enzymes, or whatever we need for our body to function correctly. Something really important for you to understand why vitamin D is multisystemic is that practically all the cells in our body have a nuclear vitamin D receptor. Let me explain that nature always has a saving instinct. It won't spend more than necessary. So if we understand that almost all our cells have this receptor, it's because vitamin D is going to be absolutely fundamental. What am I going to tell you about the importance of vitamin D, especially in the musculoskeletal system? But as we'll see now, it has many more applications. Often in consultations, people ask, so how do I take it? What foods contain vitamin D? Well, here you can see that there are different foods, but by far the most effective thing in this case is sun exposure on uncovered skin. So just sitting under an umbrella or through a window won't cut it. It has to be direct exposure. It mentions arms and legs, but it can be practically the whole body, and we'll explain how that works now. As I mentioned, the main production of vitamin D happens when the sun hits our bare skin, transforming 7-dehydrocholesterol into vitamin D, which is called cholecalciferol. It has to go through 2 pathways, one in the liver and the other in the kidneys, to be converted to its active form that we have in our blood. We also get some vitamin D from food, but it only covers about 20% of our organic needs. So getting sunlight is really important. What is happening to us? Well, with the kind of life we lead, maybe in summer we get lucky and have more sun exposure, but you can imagine the disaster that usually happens, at least here in Spain, in winter, where you practically leave for work at night and come back home at night. Then during commutes, we travel by car, subway, or bus, and we don't get direct sunlight. So we generally have great rhythms at this level, which is why I insist on the importance of sunlight. Most people know about the physiological actions of vitamin D and its effects on bone metabolism, but it has other extraskeletal effects that are just as important. As we just mentioned, genomic transcription is very important, and Ruth will talk more about that in depth. There are also effects that don't depend so much on genes, but have a huge impact on the endocrine system and everything that comes with it, like immunity, pancreatic function, cardiovascular health, muscle, and the nervous system. As you can see, it's practically the whole body. When we have a deficiency of vitamin D, we can develop osteoporosis. When we have a deficiency of vitamin D at the genomic transcription level, we can experience failures and diseases that lead to these kinds of poor transcriptions or bad genetic control. At the immune level, we can suffer from systemic lupus erythematosus, recurrent infections, Hashimoto's thyroiditis, Sjogren's syndrome, or dry syndrome, and it's often linked to cancer. When the pancreas doesn't have enough vitamin D, it can develop insulin resistance, and it's also linked to type 1 autoimmune diabetes. At the cardiovascular level, we can have the famous metabolic syndrome, hypertension, dyslipidemia, obesity, insulin resistance, and chronic obstructive pulmonary diseases. At the muscular level, it's associated with pain and sarcopenia. Sarcopenia means we don't have healthy muscle, we have muscle atrophy or low strength. We can have spondyloarthritis, inflammation, and it's also related to fibromyalgia, fractures, and of course falls. And at the nervous system level, something very important, when we have this deficiency, is multiple sclerosis. From an epidemiological standpoint, the populations at risk of having vitamin D deficiency are all of these that I'm listing here. Obviously, if we've said that the most important thing is sun exposure, when we don't have this sun exposure or it's insufficient, like when we're covered in clothes from head to toe. Using sunscreen, environmental pollution, basically, all that layer of junk that often covers our skies and prevents sunlight from getting through, or our lifestyle, it means we don't produce enough vitamin D. If we have lactose intolerance, which is associated with dysbiosis or not eating dairy products, we can also have this with this I am not a staunch defender of milk, but it is true that it is often associated. If we have malabsorption, it could be due to intestinal dysbiosis, or if we've had surgery like a cholecystectomy, which means our fat metabolism isn't working properly. If we have malabsorption diseases like celiac disease, we can have vitamin D deficiency. If we have dark skin, people of color actually have a barrier and may have a greater deficiency of this vitamin. If we have malabsorptive diseases, such as celiac disease, we may have a vitamin D deficiency. If we have dark skin, people of color actually have a barrier and may have a greater deficiency of this vitamin. As for obesity, vitamin D gets trapped in adipocytes in the form of secosterol. So it's like we don't have it. We have it, but it's being held back. Chronic kidney and liver diseases, as we have said, these two filters are needed and do not function properly, and the active hormone is not synthesized. Vitamin D gets trapped in adipocytes as secosterol, making it unavailable. Elderly people can also have this deficiency due to sclerotic, thicker skin that prevents sunlight penetration. Institutionalization or infrequent outdoor activity, like going out once every 2 weeks, doesn't help, even if sitting by a window. Certain medications like glucocorticoids and antiretrovirals also contribute. Also, being institutionalized or not going outside, like we see with a lot of elderly people who only go out once every 2 weeks, even if they sit by a window, that doesn't help. And then there are certain medications like glucocorticoids, antiretrovirals, and so on. As you can see, there are a ton of factors that lead to vitamin D deficiency. So this can't just be a trend. There are a lot of underlying issues that cause this deficiency. When it comes to pain, regarding the musculoskeletal system, vitamin D deficiency is associated with widespread pain, polyarthralgia, polymyalgia, and all the central sensitization syndromes, particularly fibromyalgia. They are significantly deficient in vitamin D. Dysmenorrhea or menstrual pain can also be associated with this. It can also be linked to dysbiosis, whether intestinal, requiring high vitamin D levels. Lower back pain, notably in obesity, is due to this trapping. Dysmenorrhea can be associated with this. It can also be linked to dysbiosis. Lower back pain, especially in obese individuals, is due to this, and headaches or migraines, sometimes associated with low magnesium levels. Lower back pain, especially in obese people, precisely because of what I am telling you, because of this kidnapping, and headaches or migraines, although we would need to investigate a bit more about what type of headache or migraine it is, because sometimes it's associated with low magnesium levels, which also goes hand in hand with vitamin D deficiency. So it's clear that to get the necessary vitamin D levels for the body, we need the sun, and it's not enough to rely solely on diet. That's something we need to be very clear about. But also for vitamin D to work properly, bone metabolism relies on 4 pillars. One is vitamin D, another is vitamin K, another is magnesium, and the last one is calcium. So we explained these modules in great detail with a lot of scientific documentation on how administering one or two of these four pillars can do more harm than good. In other words, we need to have all four pillars for the table to be stable. Here we have a study that started to show, and this is a bit old, that in terms of bone metabolism, vitamin D works in a much more active way when we have the others, and it's clear that their functions are synergistic. In other words, we need to have all four pillars for the table to be stable. Here, we have a study that started to show, and this is a bit old, that in terms of bone metabolism, vitamin D works in a much more active way when we have the others, and it's clear that their functions are synergistic. As you know, vitamin K is also essential for preventing bleeding. It has a stabilizing factor for blood coagulation. Okay, so problems we encounter with vitamin D are that there's a lot of fear about giving it because if you exceed the dose, it can be toxic. Well, unless someone has a kidney disease, a very severe liver disease, or a significant insufficiency, the mechanisms the body has to excrete excess vitamin D are really safe. Only when we take in a lot, usually through very aggressive and prolonged supplementation, can we have problems. But it's extraordinarily rare. So this kind of demonstrates it a bit, the values we can have for toxicity and non-toxicity generally. Up to 50,000 units of administration are completely safe, anything below that. So there's no need to be afraid of administering vitamin D. Right now, the conventional values being set are 800 units a day, and honestly, that seems very low to me. We should be talking at least about 2,000 units or more, and depending on whether it's a preventive treatment or a treatment for diseases, when someone has a severe problem or something like that, you need to give a lot more and nothing's going to happen. And what ranges do we have right now to know if we have adequate or inadequate vitamin D? Well, it's currently considered that between 30 and 60 nanograms per milliliter would be adequate. 30 seems low to me. We should aim closer to 60. For me, between 40 and 60 would be much more optimal. And if someone has any illness, it should be directly at 60. Do the clinical labs we use really talk about 30 to 100, right? But, the virtue is always in the golden mean. So being around 40 or 50 would be really good. When we have a deficit of less than 30, then from 30 to 20. Things are already a bit complicated and difficult. But when we have a very significant deficit of less than 20, which is very common, 2001, tremendously common. Here, of course, we have to supplement very intensely. This cannot be allowed, and right now we find many health centers where they are accepting octopus in this sense. Well, we need to raise it a bit and all, but don't worry, it's fine. No, what we've said is that it's a pre-hormone, it's fundamental. We still need to be much more intense. When we have at-risk populations, we would say that for this type of person or for normal prevention, we would need doses between 2,000 and 1,000. Personally, I take 5,000, and if I had a significant systemic illness, I could even go up to between 5,000 and 1,000. But of course, this always has to be under medical supervision. I personally take 5,000, and if I had a significant systemic illness, I could even up to between 5,000 and 10,000. But of course, this always has to be under medical supervision. But if we're talking about ranges, let's say for normal prevention, these would be optimal. When should we ask for a vitamin D blood test? I wouldn't ask for it all the time. But if we have widespread pain, if we have fibromyalgia, if we have any type of autoimmune disease, rheumatoid arthritis, lupus, psoriatic arthritis, if we have a neurological disease like multiple sclerosis, or if we have obese people with persistent lower back pain, or if we have depressive syndromes, let's not forget that depressive syndrome is related to the nervous system, and the nervous system is related to myelin, which is also connected to neurotransmitters and the fat we have in our brain. So just imagine generally having high vitamin D is also related to reversing this, one of the causes being headaches and certain dysmenorrhea. For these cases, I always ask for vitamin D to clear up any doubts. Yeah, because it's something so incredibly beneficial with such a natural and physiological approach that it's worth it. And well, to wrap up the presentation, I'm going to give a brief summary of what would be necessary. On one hand, getting sun in a sensible way. We're not talking about going in August at 5 p.m. or at 4 p.m. to get some sun. There are mobile apps that tell you, depending on the season and your location, what type of rays are best for getting sun exposure without burning. These apps provide detailed information about the intensity and type of ultraviolet rays and offer personalized advice on how to safely enjoy the sun. We've said that the adequate levels of vitamin D should be between 40 and 60, and we must never forget the supplementation of the 4 pillars: vitamin D, magnesium, vitamin K, and calcium. It's essential to include healthy fats in our diet, like olive oil, and we need to be careful with electrosmog, meaning all the radiation pollution can lead to a vitamin D deficiency. So, I hope it's at least clear, and above all, that we are aware of the importance of this vitamin.